Thank you, Mr. Deputy Speaker, and I'm very grateful to Mr. Speaker for granting me this debate. And I'm very proud to support a government that has committed to the national living wage to be equivalent to 2/3 of the median income by 2024, in addition to reducing the age for accessing the national living wage to 23 this month and reducing it further to 21 by April 2024. We want work to be worthwhile and an effective route out of poverty, so it's important that everyone is entitled to the legal minimum wage. Unfortunately, the combined impact of the National Minimum Wage Act 1998 and the National Minimum Wage Regulations 2015, along with the provisions of the Care Act 2014 and the enforcement role of HMRC, have all been completely ineffective in enforcing the law for one of my constituents, a carer who is owed £62,961 of unpaid wages below the minimum wage. There were also 4 other carers in the same position, and who knows how many others across the United Kingdom are in the same position. I will use this case to demonstrate how the law has not worked effectively. I do not expect my honourable friend the Minister to comment on the individual case, but I would like him to set out the plans the government has to remedy the flaws in the current legislation so that an effective remedy can be provided to people like my constituent when now there is none. My constituent, I shall call her Mrs. Wright, it's not her real name, provided care for 7 years to a disabled woman who I shall call Mrs. Edwards, also not her real name. The wages to pay Mrs. Wright were provided by Luton Borough Council and paid by a local charity into the account of the person being cared for, and cheques were then made by Luton Borough Council to make sure that the money provided was paid over to the carer. Section 33 of the Care Act 2014 enables care to be devolved to the person being cared for who enters into a contract of employment with her carer. After 7 years of good and faithful work caring for Mrs. Edwards, the local charity who'd received funding from Luton Borough Council sent the carer a schedule showing that throughout the entire 7-year period, she'd been underpaid a total of nearly £63,000. The local charity also paid the premium for an insurance policy to cover employers' liability and legal expenses and costs should the carer have cause to sue the person being cared for, her employer, Mrs. Edwards. Mrs. Wright, the carer, was never provided with the contract of employment by her employer. Both Luton Borough Council and the local charity say they are not liable for this massive underpayment of wages because the contract of employment is between the carer and the person being cared for and has nothing to do with either of them. The legal expenses insurer did not even bother to reply, which is completely shameful as well. There's no point suing the person being cared for, the employer, because she lives in a rented flat, has no other assets, and all her income comes from state benefits. As my constituent Mrs. Wright's solicitor said to me, this is a wrong with no remedy. So the aim of this debate today, so that the Minister and I are not wasting our time, is to make sure that a remedy is provided to Mrs. Wright and other carers in her position, so that the law requiring the payment of the minimum wage applies to them as well as to everyone else. The matter was first brought to my attention in the summer of 2018. I did my research and indeed found out that everything I'd been told about the inability to secure the payment of wages legally due was true. So I contacted Her Majesty's Revenue and Customs to try and get enforcement action. HMRC said in a letter back to me that they were, and I quote, determined that everyone who is entitled to the national minimum wage should receive it. That turned out to be a hollow phrase, because no effective enforcement action can be taken against an employer who has no assets and indeed never had any in the first place. Luton Borough Council wrote back to me to say, any issue regarding alleged historical underpayment of minimum wage will be a matter for the person being cared for and the carer to resolve. I should point out there is no alleged underpayment because the agency employed by Luton Borough Council to check wages paid against wages legally required to be paid came up with a schedule showing the underpayment of nearly £63,000. So, having hit a brick wall with HMRC and with Luton Borough Council, who were the local authority responsible providing the person being cared for with funds to pay for the care provided, I went to see the previous Minister for Small Business, Consumers and Corporate Responsibility, who was very sympathetic and agreed there was indeed a problem. At that meeting, I was told that local authorities did indeed have a responsibility for direct payments, in that they must be satisfied that personal budget holders are capable of paying the minimum wage, and the local authority should have undertaken a 6-month review, after which the local authority should have reviewed the making of the direct payment no later than every 12 months. The Minister's predecessor then very helpfully wrote to the Chief Executive of Luton Borough Council, pointing out that they should have had an effective monitoring process of the direct payments to ensure the individual fulfills their responsibilities as an employer, and that following the 6-month review, the local authority should have reviewed the making of direct payment no later than every 12 months. Luton Borough Council, in their reply, said that the carer had been paid a fixed weekly rate based on unmeasured work hours, when in fact the carer had very clear hours that she was expected to work. The Minister's predecessor also wrote to the Minister of State for Care at the Department of Health and Social Care to explain the problem. The previous Minister for Care wrote back to say that Luton Borough Council should have been satisfied that the person being cared for was capable of managing direct payments by herself or with the help of the charity who was asked to provide that help. As I said earlier, it was the local charity Luton Borough Council used who have produced a schedule showing an underpayment of wages throughout an entire 7-year period amounting to nearly £63,000. I've raised this matter before on the floor of the House with the leader of the House of Commons who said, "I am clear that care workers provide essential support to some of the most vulnerable members of society, and it is essential that they are paid in accordance with the law, including the national minimum wage for the work they do. This is a responsibility of local authorities, which should ensure that personal budgets are sufficient to deliver a person's care needs, including making sure that they cover the cost of wages. And local authorities have a duty to monitor how personal budgets are spent. The Department of Health and Social Care will take this up with the local authority and ask it to investigate what sounds like a very serious and concerning case." I've also had a meeting with my honourable friend the Minister, replying to the debate this evening. Now, in the 2019 Queen's speech, the government announced that it would legislate to create a single enforcement body in an employment bill. That bill would give us the opportunity to remedy this very serious loophole which I have outlined. We should also remember the payment of premiums for an insurance policy to cover the employer's liability and legal expenses and costs, which has been of no assistance whatsoever in this case. The Minister will agree with me, I'm sure, about the importance of people receiving the wages they are legally entitled to. And we share a commitment to increasing the minimum wage to make it always worthwhile to go out to work and to lift more people out of poverty. I would please ask him to make sure that the single enforcement body in the employment bill will be up to the task of providing effective remedy in situations such as the one I've described, and that it has retrospective power to help diligent, hard-working and highly compassionate carers, such as my constituent, Mrs. Wright.
Thank you very much, Mr Deputy Speaker. I'd like to congratulate my honourable friend, the member for South West Bedfordshire, for securing today's important debate and indeed his tenacity in supporting and representing his constituent. I'm proud to serve as the Minister responsible for national minimum wage and national living wage and workers' rights, in amongst my other responsibilities. And I very much value his fulsome words for the benefits of the national minimum wage, to make sure that we can encourage people, and as he rightly says, to encourage people that work pays, that we must protect the people at the lowest in the lowest pay grades, but make sure that they can stay within work and have a fruitful career. Because this government is committed to building an economy that works for everyone. Through that national minimum wage and the national living wage, we continue to ensure that the lowest paid in society are rewarded fairly for their contribution to the economy. In April, we increased the national living wage by 2.2% to £8.91, and that's the highest ever UK minimum wage. A full-time worker on the national living wage will see their annual earnings rise by over £345. That amounts to a total increase of more than £4,000 since the national living wage was announced in 2015. But we also lowered the age threshold for the national living wage to 23, and as a result, 23 and 24-year-olds will get a 71 pence increase. And we increased the time for which employers must keep minimum wage records from 3 to 6 years. That means workers will get more of the historic arrears owed to them. The government is committed to cracking down on employers who fail to pay the national minimum or national living wage. And that's why I'll indeed give way.
Can I first of all thank the Honourable Gentleman for South West Bedfordshire for bringing this forward. I'm always encouraged by what the Minister says, and it is encouraging of the things that have been done. But could I ask the Minister this? Does he not agree that there is a need to ensure that there are some loopholes which are allowing casual workers to have their hours not recorded, and therefore not having an appropriate minimum wage in force must be closed? And can I ask the Minister, is it the intention of his government to ensure that employers will start doing the right thing and instead of at this moment in time that they're able to avoid it? Thank you.
I thank the Honourable Gentleman, and he raises important points twofold. First of all, about anomalies, and it's important that ignorance is no defence in terms of paying the national minimum wage, and that's where enforcement comes in, which I'll expand on in a second. But he's absolutely right to raise these issues, that we must make sure that we're not balancing the books of companies are not balancing their books on the poorest paid within their companies and indeed society, as I've said. So we relaunched the minimum wage naming scheme on the 31st of December, naming and shaming 139 employers, including some of the UK's biggest household names, for failing to pay the minimum wage. And we've also doubled the budget, more than doubled the budget for minimum wage enforcement and compliance since 2015. There are now over 400 officers in HMRC dedicated to ensuring compliance with the minimum wage. But I'd like briefly to take the opportunity to share the results of HMRC's work in the 2020 to 2021 financial year. It was a really challenging year, as we've heard, for the whole country. Much of HMRC's investigations are carried out face-to-face. They can arrive unannounced at business premises to check minimum wage records or to interview employers and workers. These face-to-face visits clearly had to be limited in line with COVID restrictions, and with many businesses temporarily closing their doors. Nevertheless, this government believes that the pandemic is no excuse for not paying staff correctly, and especially in sectors like social care and retail, which have provided invaluable services over the last year. So I'm pleased that HMRC continued its enforcement and compliance work, prioritising desk work where possible and also expanding its educational work with employers and workers. So despite the pandemic, in 2020 to 2021, HMRC closed over 2,700 cases, securing more than £16.7 million in arrears for more than 155,000 workers. They also issued 575 penalties worth over £14 million. HMRC also contacted more than 770,000 employers and workers to improve awareness of the minimum wage. As part of this, they sent over 400,000 texts to apprentices regarding the risks of underpayment from unpaid training time. They wrote to nearly 200,000 employers and workers, and they produced a variety of webinars and educational videos that accumulated nearly 20,000 views. One of these webinars is aimed specifically at the social care sector, covering travel time, waiting time and breaks. Around 12,000 letters are being sent to CQC registered providers of home care service to highlight this webinar. And this brings me on to my honourable friend's concerns. The government acknowledges the particular challenges in enforcing minimum wage in the care sector. We estimate that approximately 27,000 social care workers were underpaid the national living wage or national minimum wage in 2020. This represents just over 3% of all workers in the sector and is in line with previous years. All workers deserve the wage they're legally entitled to, but particularly key workers in the current context of the coronavirus pandemic. The government therefore asks HMRC to focus on the sector in its targeted enforcement activity. The government has also recently published comprehensive revised minimum wage guidance for all employers. That includes guidance on the recent Supreme Court judgment on sleep-in shifts, where we now have clarity after years of evolving court judgments. But I'm well aware of my honourable friend's concerns about social care workers. We met late last year, as he's outlined, to discuss the issue of care workers providing care to individuals with direct payment arrangements, also known as personal budget holders. And I appreciate the situation with personal budget holders is particularly tricky. They're vulnerable individuals, but in minimum wage terms, they are often the employers of their carers. And that means under minimum wage legislation, any enforcement action by HMRC for underpayment of their care workers can only be taken against these individuals. But I'd like to give some assurances on how enforcement works in practice in such cases. Where complaints are received, HMRC works with all parties to ensure that personal budget holders receive the necessary help and support while also continuing to protect the rights of workers. And as my honourable friend has said, local authorities have a duty of care under the Care Act to give personal budget holders clear advice about their responsibilities as an employer. Local authorities must also be satisfied that a personal budget holder is capable of managing direct payments, and they should put in place an effective monitoring process relating to those direct payments. Crucially, this involves checking to ensure the individual is fulfilling their responsibilities as an employer. Now, I understand there are examples of local authorities stepping up to financially assist personal budget holders where minimum wage cases are brought against them. And I strongly encourage this, which is in line with the Local Authorities Care Act duties. But ultimately, HMRC needs to protect the rights of any underpaid worker. However, where arrears have been repaid to the worker, HMRC has discretion on whether or not to issue a formal notice of underpayment. So HMRC rightly makes limited use of its discretion in practice, but cases brought against personal budget holders are instances where I'd expect HMRC to consider using that discretion. So I therefore urge workers who care for personal budget holders and who believe they've been underpaid, such as my honourable friend's constituent, to complain to HMRC or contact ACAS for advice. But I understand, having spoken to my honourable friend, that this is clearly an issue. His individual case, which I can't comment on in detail, but is something that has been going for a number of years and is a good few years old. But as I say, admire his tenacity, working with the council as well, pushing the council to do more, and also speaking to my predecessor as well as myself, because I know he's calling for HMRC to be able to enforce directly against local authorities in such cases. However, HMRC can only enforce against the employer. That's laid out in primary legislation. But it's right, there's a clear line, so employers are always clear about their responsibilities and workers are always clear about their rights. Any change could call into question other scenarios where there are multiple parties involved in employment, such as agency workers, umbrella companies or contractors. It could lead to protracted court cases to determine who's responsible for paying the minimum wage, and that would only delay workers getting the pay they're legally entitled to. So we have therefore no plans to change the minimum wage legislation. But we're extremely proud of all of our health and social care staff. We recognise their extraordinary commitment, especially during the COVID pandemic. The 1.5 million people who make up the paid social care workforce provide an invaluable service to the nation, especially during the pandemic. Putting social care on a sustainable footing where everybody is treated with dignity and respect is one of the biggest challenges that our society faces. There are complex questions to address to which we want to give our full consideration in the light of current circumstances. And that's why the Government is committed to the sustainable improvement of the adult social care system, and the Department for Health and Social Care will bring forward plans for workforce reform later this year. We're providing an extra £341 million for adult social care to pay for infection prevention control measures and to support rapid testing to the end of June 2021. This will bring specific funding for adult social care during the pandemic to almost £1.8 billion. We're also providing councils with access to over £1 billion of additional funding for social care in 2021-2022, on top of the significant support provided over the last year to support the sector deal with COVID-19. My honourable friend also talked about the single enforcement body coming back to enforcement, and indeed that is something that we are consulting on, that we're working through as well, not least as we move towards our employment bill. We are taking the time to reflect on what the lessons that we've learned from the COVID-19 situation, those baked-in behaviour changes in work practices in the wider sense of the employment bill. That the single enforcement body is going to be a really important part of that, and I look forward to my honourable friend's contributions to that debate as we bring in the legislation to bring that new body into existence. And he has made some important points, and I'm really pleased to have had the opportunity to respond. The government's committed to ensuring that all workers are paid at least the minimum wage. This is their legal entitlement. We also recognise that personal budget holders and individuals arranging their own care are often amongst the most vulnerable in society. Where complaints are received, HMRC will work with all parties to ensure that these individuals receive the help and support they need, whilst also continuing to protect the rights of workers. I look forward to continuing the work with ministerial colleagues to ensure that all care workers are paid appropriately under the National Minimum Wage Act. Finally, Mr Deputy Speaker, can I join your words, associate myself with your words, and wish you a very good prorogation, whatever the term is, as you sit there, and you know, because members and the staff and your team have played an amazing role in allowing us to continue scrutiny of government's work and our work as a fully functioning democracy. Thank you.